Well, welcome to Facebook Live and YouTube coverage of a conversation that I'd like to have every so often on issues that are important to people of our state and nation. And clearly, today we have two really special guests that can help answer your questions on a COVID-related issue, but one that goes deeper than just COVID, and that is health disparities in our community. I couldn't have two better guests to talk about this issue. Dr. Wen, who I know to the people of Baltimore City are very familiar. She was our outstanding health commissioner in Baltimore. She is an emergency physician and currently holds a post at GW, George Washington University, as a professor and an expert. I see her on television more than I see my colleagues on the cable shows. But Dr. Wen, it's a pleasure to have you with us. Dr. Stephen Thomas, from the University of Maryland, Principal Investigator, Center of Excellence in Race, Ethnicity, and Health Disparities Research, and has done a great deal to deal with the health disparity issue. I want to start the discussion sort of by telling you where we are. I just left Capitol Hill. It was May the 15th when the House of Representatives passed the HEROES Act. It was in March when we passed the CARES Act. And we can talk about the Trump administration, and I'll be glad to share my views on how we were not as prepared as we needed to be, how our reaction has not been what it should from the White House, how the messaging has been inconsistent, how we should have been engaged with the international community in a closer way, and the list goes on. But I was proud of the congressional response during the early days of COVID-19. We passed the CARES Act, which was a major effort, bipartisan, to provide help to individual families, to businesses, to state and local governments, and to what I call a Marshall Plan to deal with the health pandemic by providing hundreds of billions of dollars of help. Well, when we passed that in March, we recognized that this pandemic we thought would be under control by the summer, which is not the case. It's still having dramatic impact on our economy, dramatic impact on families. The uninsurance benefits that we gave have expired and people still can't get work. And by May, it became obvious, and the House passed the HEROES Act. Well, almost 3 months later, the Senate has not taken up legislation, comprehensive legislation, to deal with this. And today we were supposed to start on our August recess in the Senate. There's negotiations taking place between Senator Schumer, our Democratic leader, Speaker Pelosi on behalf of the House, and Secretary Mnuchin, and Mr. Meadows, the Chief of Staff for the President, to try to come up with an agreement. I took the floor of the Senate a couple hours ago. And the first subject I mentioned that needs to be in this comprehensive package is a recognition about the disparities in our healthcare system. We know the numbers on COVID-19. We know much greater percentage of people from communities of color with the virus, with hospitalizations, and with death. The question is why? What can we do to remedy that? How much of this is systemic problems within our healthcare system? How much is directly related to COVID-19? So I want to start our discussion at that starting point. Where are we when we start? So Dr. Wen, if I could turn to you, I must tell you, you have been a consistent voice on behalf of dealing with control this virus. Why do we see the high numbers in communities of color?
Yeah, I appreciate the question, but most of all, I wanted to say thank you very much to Senator Cardin for your exceptional leadership here in Maryland and around the country on the issue of COVID-19, but much more broadly as well. And I'm glad to be joining with my colleague, with Dr. Thomas, to have this important conversation centered on communities of color. So your question is, I hope we can ask it many more times, because we should be talking about the disproportionate impact of COVID-19, that ultimately COVID-19 has unmasked underlying health disparities and economic and other disparities as well. So this is for a number of reasons. So number one, we know that COVID-19 is the most severe, the people who have the most severe effects from COVID-19 are those with underlying medical conditions. Well, why is it that people have underlying medical conditions like diabetes, heart disease, etc.? You look at our city here in Baltimore, 1 in 3 African Americans lives in a food desert compared to 1 in 12 whites. So is it any surprise that African Americans also bear the brunt of diabetes, heart disease, and high blood pressure? All of these then predispose these individuals to having severe effects from COVID-19. Then, in addition to the underlying conditions, you also have a situation where minorities, people of color, tend to be essential workers, recognizing that social distancing is a privilege that not everyone has. Also, vulnerable individuals, minorities, also tend to live in crowded multi generational housing, where if one person is infected, everybody else in the house ends up getting infected as well. And so I think we can look at this and the problem as being twofold. You've got the immediate problem and you have the underlying problem. And I think our solutions also have to target both of these, that there are urgent things that we can do right now, but that there are also these long-standing structural inequities that that we also have to work to right as well.
Thank you. Thank you. Dr. Thomas, before I turn to you, in our, preliminary exchange of information, you pointed out the number of people who have died from COVID-19. Each life is precious. We know we have direct information that 157,551 Americans have died COVID related. The number is probably higher than that. We have 3,402 cases of deaths confirmed in Maryland. Again, we expect the number is a little bit higher than that. Each of these lives are precious. And I think we just tend to see the numbers and don't realize the individuals who have been victimized by this horrible pandemic. And I agree with you. I just want to pause for a moment to reflect upon those numbers and those people, and each one, a human being that's been lost, so that we recognize what we're dealing with is so important. And so many families are grieving today because of COVID-19. Thank you, Dr. Thomas, for that suggestion. I do want to turn to you and just ask, what do we do about this? Tell me your view as to why you think the numbers are so much higher in communities of color on their vulnerability to COVID-19. I take it it's not a surprise because we saw generally numbers higher in minority communities on health results prior to COVID-19.
Well, Senator, first of all, let me say thank you for this invitation. And Dr. Wen, it's an honor to be on the screen. I call these the Hollywood Squares with you. In many ways, I feel like a lieutenant coming in from the field because I was out in the neighborhoods today, Senator and Dr. Wen, out in the Black barbershops. And that's where you get the information from the community, Senator. And one of the things I want to tell you is that, guess what? They were wearing their masks. So you ask what we can do? It is so simple what we can do. We can wear a mask. We can use our sanitizers. We can keep our social or physical distance. And you know what else we can do? Show a little more patience, a little more dignity, and treat people with respect. We're on edge, and we're seeing it pop up around the country, flare-ups around mask wearing or social distancing. So I think we got to get that message back home loud and clear. While it was not a surprise to me, who's been working in this field of health disparities for the past 20 years, what surprised me is that it was a surprise to America. That out of the kind of the margins of our medical science where we publish and Dr. Wen and I talk and come to national meetings about this issue, it goes all the way back to when you pass legislation to help create the National Institute on Minority Health and Health Disparities. That's how long we've been dealing with this. So the surprise was that America was surprised. And here's the other surprise, Senator, that in the early days of the epidemic, there were rumors that African Americans did not get the virus, that we were protected because we had melanin. I know it sounds ridiculous now, but guess what? There's a lot of ridiculous rumors still out there. So I'm out in the barbershops today, and we pilot tested. It was something quite remarkable, Dr. Wen, that I witnessed. A saliva COVID-19 FDA-approved test where the barber can literally take that test, drop it in a UPS bag, and send it to a lab and get results. You ready for this? 24, 48 hours. If we can do that in a barbershop, why can't we do that around the country? And that's where leadership comes in. When our leaders have no vision, the people perish. And our people are perishing right now. But I want you to know that I came away from that experience with hope that there's innovation happening at the grassroots level, Dr. Wen. People are coming up with creative ways of protecting themselves and their families, but they do need guidance. Where's the national guidelines for how to open up a personal service business like a barbershop or a beauty salon? Where's the national guidelines for how to open up the church in ways that don't spread the virus? We used to look to CDC or HHS. And in some cases, those agencies have been kind of muzzled. And so we're getting mixed messages. So, Senator, I would say we need a consistent message, we need a national plan, and we need to make doing the right thing the easy thing to do.
Thank you for that. I want to get back to your suggestions in a moment, but I want to at least bring up, you brought up the National Institute for Minority Health and Health Disparities. It was included in the Affordable Care Act, the elevation at NIH to a full institute. Plus, we elevated offices in all of our health-related agencies for minority health. And I was proud to be the sponsor of those amendments. I had a very talented staff person who really worked hard on that, Priscilla Ross. I like to always mention her name because diversity among our staff becomes a critically important part of advancing these issues by better understanding the challenges we have in minority communities. And Priscilla Ross brought that into our office. And as a result, we were able to get some good things done. That institute financed a study in Baltimore on zip codes. I know Dr. Wen is familiar with this. And it showed, this is a few years ago, it showed that depending on what zip code you lived in, your life expectancy could be a difference of 30 years, a generation. The point that you raised, Dr. Wen, about food deserts and access to care, et cetera, having an impact on being able to get the type of knowledge and treatment that you need to deal with any healthcare issue, including COVID-19, is clearly an area that requires a great deal more resources and attention than we're spending today. Any comment about that Baltimore City study?
Yeah, I'm glad you mentioned this, Senator. I live in the city, and I'm in the city right now as we speak because I don't really go anywhere these days outside of the city. But as I look out the window, I see the profound health disparities that I think we all know, but is worth just talking about and highlighting. That we have neighborhoods today where a child born can expect to live 65 years, and just a few miles apart, that same child, if born a few miles apart, could expect to live 85 years. And so that, when I was the health commissioner, I used to show maps of the city in my presentation, and I would show the map of where we were with infant mortality or cardiovascular disease or overdose or whatever else. And actually, I stopped showing that map because it almost didn't matter what the legend was. It was the same map over and over again. it was the same areas that had high cardiovascular deaths, that also had high poverty, that also had low educational attainment, that also had high infant mortality, that also will, in this case, have high numbers of people affected by COVID-19. And so I think it's important for us to talk about the disparities, but then also to move on to the solutions. And that's why I so appreciate all the work that you do, Senator, in implementing, right, in doing what's necessary to make a difference. And Dr. Thomas, the point about COVID-19 testing in barbershops, I think is exceptional. I think testing has been the Achilles heel of the US response to COVID-19 all along. And one big issue that we're having is that we're not targeting testing to where it needs to be. You can have great drive-through testing, and that's really important, but what about all the people who don't have cars? You can have testing that's made available through doctor's offices and urgent cares, but what about people who can't afford to go to the doctor's office, who don't have time to go? What about those individuals? What about making testing accessible wherever it is that people are, in churches, in community centers, in senior centers? I love the idea of having at-home testing. I actually just wrote a Washington Post column about this that posted about an hour ago that talks about these rapid antigen tests that are now available in Senegal and in India. It's FDA approved here. The idea that, and I don't have any relationship with these testing companies. This is just a good public health measure that you've got something that, imagine if you could spit on a piece of paper or blow your nose into something and immediately get a result within 15 minutes, not even 24 hours, but 15 minutes. You can find out whether you have coronavirus or not as a screening test. I mean, how powerful would that be, in particular to those communities that are bearing the brunt of this pandemic?
I just really want to set the record straight here for one moment, if I might. Uh, the Congress provided substantial resources to the Trump administration to develop a plan, a strategy, implement a plan in regards to testing. We've done that. It's also in the HEROES Act that passed the House a couple months ago, additional funds and responsibilities for developing a national strategy on testing. The president has not, to this date, established an understandable vision of where we're going to get to, we need to on testing, and quite frankly, has not used the capacity of the federal government to make sure that we have all of the parts of testing and all the different types of testing available to us through a domestic supply or through a reliable supply by using the Defense Production Act in order to make that a reality. Senator Menendez and I have introduced legislation to deal with health disparities in COVID-19. And one of the provisions in that bill is to target testing to minority communities. Why? For many reasons. We know if you look at essential health workers, they're more likely to have a higher percentage of minority. They're more exposed. They are at locations where it's more important for us to have an understanding of the penetration of the disease in order to stop community spreading. And they do not have the same availability of testing as we see in other communities. So, Dr. Thomas, you mentioned this issue also. Testing is really one of the barometers that we can use to first understand. And originally, we didn't even have the demographics on this disease. I mean, we had a hard time figuring out the numbers. We think it was somewhat hidden because we didn't want to talk about that. But testing gives us a lot of good information, and making it available in the most vulnerable communities seems like a first step to deal with the problem.
Well, I'd say you're absolutely right. In the early days, we would hear the term that if you weren't testing, you were flying blind. I totally agree. If you're not testing, you don't know where the virus is and where it's going. And if you're not testing in a way to examine the underlying demographics, guess what? You're flying colorblind. And Senator, we're still flying colorblind. The state of Maryland and a few other states are releasing their data by race, ethnicity, and zip code, but that is not across the nation. We do not have the federal government releasing data across the nation by race and ethnicity. I watched very carefully the hearings. Dr. Wen, you've heard them make pronouncements about making this information available. It took a lawsuit by the New York Times to get the data from the CDC. And for those of us on the front lines, we scratch our heads trying to figure out how can we be pulling in different directions in one federal government. Senator, it's also very important that if and when we finally get the test where those vulnerable communities live, guess what? The resources need to follow them. The resources need to follow the data. And I point this out because as Dr. Wen described the food deserts, as you described the being able to predict your life expectancy by your zip code, you shouldn't be able to do that in a modern society like ours. Those health disparities have become almost normative. We cannot accept, now that we know, these disparities. And so for me, this is what COVID has done. It has exposed a lot. For me to hear Lester Holt on NBC talk about social determinants of health, Dr. Wen, I'm smiling. I'm saying, oh, finally. For me to hear Anderson Cooper talk about institutional racism has a role to play in health disparities, it's like, finally, we've kind of broken through to the national audience. And that's the reason why what happened in Minnesota is also part of this public health reckoning that we're going through. The death of George Floyd went around the world. And it would be easy to ignore, Senator, if it were not so well documented, that even us in public health and medicine have a reckoning. We have to deal with the history of discrimination in our healthcare systems. We have to deal with a biomedical model that waits for people to come to the hospital when they're sick rather than helping them in the neighborhoods and keeping them healthy. And that's where Maryland comes in. The example you described around zip codes, that was the Maryland Health Enterprise Zone Initiative. 4 years, excellent results. New administration arrives and it sunsets. I think that legislation is something that the nation could benefit from. The data is there. It targets resources where we know the problem is. So we need better metaphors, and I'd like Dr. Wen, if you could even help me. Some of our medical metaphors don't work. People don't understand. Maybe it's the forest fire metaphor. Because if you see a fire, guess what? You go and rush and put that fire out with all the resources you have. If we do this right, we will not only stop the spread of COVID, we will also make the long-term commitment to address the underlying causes of these racial and ethnic health disparities. My concern is that we don't want to blame people for the disease. They're not getting this disease because they're Latino or Native American or African American or Asian. They're getting the disease because they are exposed to it by virtue of their work, by virtue of the jobs they have. And I think we need to make sure that we keep that front and center. There's nothing wrong with the people. What's wrong has been our response to stopping the spread.
Well, thank you very much for that. There are two areas in the bills that we're looking at right now. You all are mentioning issues that we really have to take a look at on overall policies in our country. And I would like to tell you, I think we have a chance to get that done in this Congress, but it's been a challenge to get these bills through the United States Senate. Many of the bills dealing with some of these underlying problems have passed the House of Representatives, but they have not been taken up in the Senate. We'll see what happens after the elections, whether we'll have another opportunity. But there are a couple areas that are in the legislation where we hopefully will be considering in the very, very near future that deal with some of these issues you're talking about. And so let me ask directly. We have a decision to make whether to increase the federal share on the FMAP program, dealing with Medicaid, to strengthen the dollars going into Medicaid. We have an opportunity to put more resources in community health centers. How important are those types of programs for communities of color or the communities that are being most impacted by COVID-19? Dr. Wen?
I mean, they're really critical. I actually was just writing something on health insurance today and thinking about how attempts to try to dismantle the Affordable Care Act of all, I mean, first of all, there's no good time to take away people's health insurance. But can you imagine trying to take away someone's health insurance in the middle of a pandemic when many people have already lost access to their health care because, unfortunately, in this country we have employment that's tied to our health insurance. I mean, it's just unconscionable to take away healthcare at a time when people need it the most. I mean, even thinking about it, even if you were thinking about it purely from a selfish perspective, which I know that none of us here would, but even if you were just thinking about it in terms of what it would impact you, it's not good for other people to have a contagious disease and to not get testing, to not seek help for it. And so I think it's really critical for us to stabilize and protect the systems in place that we have, while also making sure that we are improving and increasing access to healthcare wherever possible too, including through Medicaid expansions, including ultimately, I think, through a reconsideration, a rethinking of not just healthcare, but health. And just want to say, I cannot agree with Dr. Thomas more about hearing all these things that we in public health have always been talking about of health disparities and aiming for equity and social determinants of health, and even the word public health. I mean, there's a saying about public health that public health is invisible. It works when we are invisible because what we work on literally is prevention. And I think it's quite incredible that we're now seeing public health really be understood. And at least people are understanding that the disinvestment in public health has gotten us to where we are. And hopefully, moving forward, short term and also longer term, we will invest in this critical field.
Dr. Thomas, I want to give you a chance on this, but let me tell you some of the numbers that I've been told. I've been told that since the beginning of COVID-19, about 12 million more Americans have come to rely upon the Medicaid system because of the economics circumstances in our community. Now, that was with unemployment insurance benefits being paid. As we know, those benefits ended this week. So Congress has not extended those benefits. So more families are going to be pressed as far as affordability. And Medicaid is a lifeline for many of these individuals. So we expect it will become even more dominant. Secondly, state and local governments, the state government particularly, which is responsible for a significant part of the funding and the administration of the Medicaid system, they have to balance their budget. The largest single item in their budget is their Medicaid expenditures. And they've seen their sales tax revenues get decimated. They've seen their income tax revenues decline sharply. They've seen their entertainment, hospitality revenues down. And they see a Senate under Senator McConnell who does not believe there's a need for any additional federal support to our state and local governments. The House Heroes Bill did provide additional relief, but that has not passed the Senate. So with all that involved, how critically important is it for us to make sure that the Medicaid program can be maintained and to cover with quality health care those who qualify for it? And how important are the health centers in our community in providing access to care in many of our neighborhoods?
Well, Senator, you've hit the nail on the head. We have an infrastructure that has been suffering from what I'll call deferred maintenance. So all the elements you just described, they are there, but their capacity is stretched to a breaking point. And that's what COVID has exposed, that stretch to the breaking point. If you look back at the history of all the things you just mentioned, it took a struggle to get those things in place. It wasn't easy. We're in a struggle right now. And this is an opportunity to really make a great leap forward. We can look around the world at our sister countries, our peer institutions, our peer countries that we would compare ourselves to, Germany, Great Britain, all the industrialized countries. They're not having the same experience we are because their public health infrastructure is woven into their society. It's not the hidden, invisible, as Dr. Wen described. And so I think that it's very important that we look at those lessons. And one of those lessons is that health touches all policy. It took COVID to let us see, how is COVID affecting transportation? How is COVID affecting housing? How is COVID affecting access to food and the food production supply chain? Who could have imagined that's a health issue? And so I think that if we look to Canada, if we look to Great Britain and other industrialized countries, they have adopted a health in all policy approach. I think that's something we should look at here. There's a little patchwork of health in all policy initiatives around the country. It needs to be taken up on a federal level. And again, legislation is vitally important, but communicating to the consumers, to the people, is also important. I'm sure Dr. Wen remembers when we were working on the Affordable Care Act, there were people that said, I want the government to get their hands off my Medicare. That kind of disconnect cannot happen again. So if we're expanding Medicaid, it needs to be clear that that's your tax dollars at work. That's your federal government at work. This is how we help serve the people, and not let that be distorted. There's one other thing I have to mention, and that is, while public health is out of the shadows, Dr. Wen, and leaders like you are out front and center with Dr. Fauci and many of the others, I have never in my career seen such attacks on our public health professionals. People needing security details, people resigning from their positions. Senator, this is something serious. We have never seen this in the United States. We can nip this in the bud, that our public health professionals are following science. There's no reason to be attacking them, threatening their families, threatening their lives. I think it's very important to get ahead of that early.
Dr. Thomas, thank you for mentioning that. I agree with you completely. And we see this, and I'm pleased to see how many people have come to the defense, but the attacks are just outrageous. Let me first thank our two guests, Dr. Wen, who is well known to the people of Baltimore, and I think our nation now, professor at George Washington University and an emergency physician, former Baltimore City Health Commissioner, and Dr. Thomas from the University of Maryland, a principal investigator, and has done a lot of work in regards to health disparity issues and dealing with health disparities. We have a question from Bardia from Montgomery County, who asked on YouTube, will you support more international funding to combat COVID so we don't see an increase in poverty around the world, which disproportionately affects people of color like it does in the United States? We've been talking mostly about what we're doing here in the United States, but I'm going to give my guests a chance to respond first, but I'm going to weigh in on this question as to how important it is for the United States to be engaged internationally in dealing with this pandemic from the point of view of controlling the pandemic, but also in dealing with the poverty and justice issues globally, our values. Dr. Wen?
Yeah, I mean, it's an incredible question, because I do think it recognizes that it's all of us in this together, which I think this disease has really brought us to understand, because diseases know no boundaries, and especially contagious diseases like this know no boundaries. I mean, I think something that this pandemic has also illustrated is that we are only as strong as our weakest link. We're seeing this now in our own country, that there are surges of infections that are occurring even in places that did not think that they could ever have exposure, or even in places that were initially successful in reducing their case counts, they're now seeing rises again. And so I think coming out of this, we need to be investing all throughout the world. Although I will say that right now, I hate to say this, but this is the reality, that the US is actually the weak link. So we need to be very critically investing in America. I mean, we are 4% of the world's population. We are 25% of the world's infections and deaths. So we are the weak link. We have states, entire states of the country that have a higher per capita rate of infection than many other countries. And so I think we need to be boosting infrastructure everywhere else, of course, longer term, but we really need to we really need to be doing that here in the US too.
Dr. Thomas? Dr. Thomas?
Well, what's so interesting, Senator? The Centers for Disease Control literally had field stations out in other countries to help them manage pandemics. And the current administration pulled those things back. It is as if we were pulling away from the world. The world has modeled their Centers for Disease Control after ours in the United States. We are the national leaders. This is why everyone is so shocked that we would pull away from the world. We would pull away from the WHO, the World Health Organization. These are vital international infrastructures that keep us all healthy. If COVID has taught us anything, it is that nature will have its way. COVID is an act of nature. It has been our human response that tells us how our societies are organized. And if we're organized in a way that values all life, are we organized in ways that are going to let some lives be less than? So all that you've described is vitally important. And at the same time, when we would want to make greater investments, I'm seeing a pullback. And I don't know who to call or what lever to hit to say we cannot retreat from the world in the midst of a global pandemic.
Let me bring you up to date on this. I keep referring to two bills. One, the HEROES bill that passed the House of Representatives over 2.5 months ago. It was 3 months ago. That was very comprehensive and included a lot of the addressing a lot of the issues we've been talking about today. And then the HEAL Act that was brought to the attention by Leader McConnell, the Republican response. And they're the two bills that we've been working on. The leadership is now in negotiations to try to get a bill on the floor passed and signed by the president within a very short period of time. We all hope they're successful. So one of the areas they're negotiating is the international response. The Leader McConnell's bill provided some funds for the international response, but it was limited to vaccine development, which is an important part. Vaccine development and distribution, production and distribution. It's important. I don't want to minimize that. But none of the other areas that are referred to by Bardia's question. I led a bipartisan letter of senators requesting that we provide robust support to the international community. And I'm very pleased that we have leadership on the Republican side of the aisle that's fighting hard also to make sure that we have funds put in for this purpose. And we're doing it for two reasons. One, you can't control the pandemic globally unless you work globally to control the pandemic. It'll come back to the United States if it's in other parts of the world. So it's in our interests to control the pandemic, to use, as Dr. Thomas said, the expertise of America and the capacity of America to get this pandemic under control. And then secondly, the essence of Bardia's question, it's our values is to deal with world poverty. I questioned the nominee yesterday at the United Nations Post about the Sustainable Development Goals, where we joined together with the international community to say that we want to end poverty in the world. We want to make sure there's access to health care. We want to deal with gender equity. All those issues are U.S. values that we bring to the international community. And we need to be involved in COVID-19 in order to further those values, which lead to a more stable world and a safer world for Americans through our leadership. So I appreciate this question, and it gives me a chance also to talk a little bit about what we're trying to do in order to help this situation. I am confident we're going to do much better in the final bill on this issue because of the attention that we've paid to it. We recognize that we have global responsibilities here. So let me get to another area that you mentioned. that really has me concerned about adding to the problems of disparities. The moratorium on eviction ended. It was in the CARES Act. It no longer is there. Unemployment insurance, federal $600, has ended. More and more families are at risk. The numbers that I have seen, somewhere around as many as 15 million home renters are going to be in risk of eviction for not being able to pay their rents. We've been told as much as 6% of homeowners are at risk of not being able to pay their mortgages, and it could be subject to foreclosure. We're in the middle of a pandemic. How do you protect your health and the health of your family if you don't have a roof over your head? How are these families going to be able to afford affordable housing unless part of our response to COVID-19 is to provide meaningful help so people can maintain affordable housing? This is a key part of the HEROES Act that passed the House. It's not included at all in the HEAL bill that was presented by Leader McConnell. This is part of the negotiations that are taking place now, and there are many dynamics to it. But you talked about so many of the systemic problems of racism in America and poverty in this country. If we don't deal with housing, aren't we just making it so much worse, in addition to, of course, compromising health on COVID-19? How high of a priority is housing in dealing with these issues? Let me start with Dr. Thomas. I'll rotate a little bit, give Dr. Wen a break here. Dr. Thomas.
I think it's vital. You have to have a roof over your head. And if you're worried about where you're going to lay your head at night, you're worried about ending up on the street, I think it's a lot harder to practice all the COVID mitigation behaviors we want people to practice. I see that people on edge. I've met some of the people who didn't qualify for any of the loans, or they actually qualified, but they didn't have the wherewithal to get on and actually make the application. So this is where that the whole notion of health and all policy comes in, Senator. Who would have imagined that housing security gets amplified because of COVID-19, and that helping people keep their homes, keep their apartments, and not have to worry about that actually enables them to practice the mitigation, social distancing, and all the other things we need to do to stop the spread of this virus. So in a society like ours, it's unconscionable that we have now hundreds of people, maybe thousands, worried about, are they going to get evicted? So vitally important. And again, a public health issue that maybe prior to COVID-19, we did not think of as a health issue, not for the general population. There were some physicians writing prescriptions for housing for the homeless, recognizing that the homeless needed to get off the street and be safe. But we're talking about people potentially risk losing their homes and apartments who have jobs, who have careers. We're talking about people in the middle class, Senator and Dr. Wen, who are now feeling the anxiety of falling out of the middle class and maybe not having that opportunity for their children. This is our wake-up call. It doesn't have to be. I think that's the message even with COVID. All the models are predicting what the infection and the death count will be. It's a prediction. It doesn't have to be. We can change that trajectory by what we do. So the key is, are we getting the message out to the people at the grassroots level? That's why I come back to the barbershop. It's got to resonate there. They've got to understand that what you're doing in Washington is to help them keep their homes, help them keep their businesses. We got to be able to talk to them and make it plain. And that way, we'll get out of this together.
Dr. Wen?
Yeah, I mean, I of course I completely agree with what Dr. Thomas said. I also wanted to address your question, Senator Cardin, about housing. So, without question, housing is an integral part of healthcare. Without question, exactly as was said. I mean, if you are concerned about whether you're going to have anywhere to come home to, it's pretty difficult to focus on these other public health measures. Or if you're worried similarly about losing your job, you're probably also going to be making different types of decisions. You know you're supposed to stay home, but if staying home means that you're going to lose your job, are you really going to do that? I also, I see patients, and had a patient who had exposure to someone with COVID-19, and there was a big backlog of testing. And I was recommending to this patient to get testing, but in the meantime, to keep himself isolated from his family members and to not go to work. And he just laughed. And, he said to me kind of incredulously, I live in a house with four young children. My parents also live in the house, and there's an aunt who lives in the house. There's no way that I can keep myself isolated. There's no room to keep myself isolated. And this test is going to take 10 days to come back. Am I supposed to keep isolated and not go to work for those 10 days? I mean, I think we need to see that for so many people, the ability to follow our recommendations are a privilege. And this is why I have so much of a problem also with those who make decisions on our behalf and saying basically that, people who say, well, individual liberty should, excuse the pun, Trump public health protections, that wearing masks somehow has become politicized. I mean, we are not deciding just for ourselves. We're also making decisions on behalf of other people and asking other people to make these sacrifices in a way that's really unjust and perpetuates these inequities. And so, all this is to say, yes, housing is something that's also really important. But as we think about the types of priorities that would particularly help to reduce disparities and reduce the disproportionate impact on communities of color, we should also be looking at isolation and quarantine facilities. We should also be looking at paid sick leave. We should also be looking at guaranteeing people's jobs if they do end up being caregivers to family members. We should also be looking at worker protections. When you see these outbreaks that are occurring in meatpacking plants, I mean, who is working there? It tends to be immigrants and people of color. We should, by the way, speaking of immigration, also make sure that the public charge rule is not being enforced. That we're not that ICE and immigration detention is completely separate from our healthcare system, so as to not deter people from seeking needed care. I could go on, but I will not.
Well, Dr. Wen, my staff was listening to your response. They now have the subject for many more of my Facebook Live sessions that get into a lot of these subjects. But since I have the former Baltimore City Health Commissioner here, I want to give you Catherine's question. Catherine asked on Facebook, how can we predict people's voting right? How can we protect people's voting rights in November 2020 without contracting COVID? Will COVID be used as a way to suppress voting in minority areas? The second part's a little political. The first part, though, is from a public health perspective, how do we protect our constitutional bedrock principle of voting in the midst of COVID-19?
Yeah, it's a really important question. And I'm going to give you two answers because I think there's one that's the obvious answer and then one that's less obvious. So the obvious answer is you need to make voting accessible to all. There are going to be people in November, especially the trajectory that we're on. We are going to have flu season coming in as well, who will not feel comfortable going in person to vote. And actually, one could argue that an in person voting facility that's indoors, where people have to stay indoors for long periods of time, shoulder to shoulder, maybe with other people who are not observing mask wearing. I mean, that's not a safe place to be. And if somebody has chronic medical conditions, if they're a caregiver for a child who's on chemotherapy, or an elderly individual who has multiple medical conditions, I mean, you can't make this person choose between their own health and exercising the constitutional right to vote. That's just not appropriate. And so you should make these other absentee, mail-in, these other mechanisms available to protect their health and protect their rights at the same time. That's the kind of the obvious answer, and I hope one that at least all of us on the call can agree to. There's another answer too. The other answer is that we could, and I'm not saying that this is the right answer, but this is another answer, is that we could do what other countries have done. Other countries suppressed their level of COVID infections down to virtually zero. And as a result, they've been able to resume many of the activities that we unfortunately cannot now. We are not able to resume school. We have not been able to go back to work safely. We cannot vote as safely in person, and probably in November. But we could actually do that. Again, I recognize that probably politically this will not be possible. But if we entered a period of lockdown for 3 to 4 weeks now, we could actually strengthen our testing in that period of time. We could actually suppress the level of infections, reopen safely, and allow for all these other activities to come back. But in the absence of that kind of national effort, I think we just need mail-in voting to protect people's health and rights.
Thank you. Dr. Thomas, I'm going to expand this a little bit and ask you to respond to this. We've had some really good discussions in the United States Senate on how to deal with systemic racism and how do we deal with it as an institution. And it was my colleague, Senator Menendez, who told us the 3 Ps, deal with process, people, and policy. And I really want to expand that because process is having that's sensitive to these issues, that you have the right subject matters that you're taking up, et cetera. People is having people who know the circumstances, diversity in key positions, whether it's in the United States Senate, whether it's staff, whether it's in the hearings that we have, or whether it's in our community. And the third, of course, policy. You need policies that address these issues. So Senator Tim Scott, a Republican, and myself have introduced legislation, the REACH Act, which is an effort to deal with this issue in COVID-19 and in healthcare. And it recognizes that we need to have a workforce in healthcare that reflects the community. People, we need the people there. We saw that the great research that we've done historically in this country in healthcare, great work at an institute, National Institutes of Health, which is located, headquartered in my state. Historically, they didn't have that diversity. And therefore, the focus was not as strong on minority communities and women as it should have been. So I'm giving a plug for my bill with Tim Scott, but how important are these issues in dealing with the disparities we see? The question that Catherine raises is elections. And to me, it's unconscionable to try to target voters not participating as a strategy to win an election. But that's been done here in America. How important is it for us to make sure that our process is fair, that we have the people that we need that represent diversity in America, and that we enact the policies that are going to address these disparities?
Well, Senator, I have hope. I'm an eternal optimist. I believe in America. We're the unfinished project of democracy. So each generation hands to the next generation the unfinished business. I feel like I've been handed a torch. I'm sure you feel the same, and Dr. Wen as well, that John Lewis handed us a torch. This is our job to push it forward, to make voting something that everyone can do easily. It's vitally important for our society. And I would not have thought this before COVID, that a infectious disease that doesn't care what your party is, doesn't care what your zip code is, could force us to come back together as one community, as one people. I actually think that it is in this arena of public health, solving this problem, that will bring us back together and strengthen our democracy. Because we're going to have to stand up for something. We're going to have to stand up and be counted, not just at the voting booth, but at the census. Look at all the things kind of converging. The census is so important for all the infrastructure support that we now know is broken. And I'm reading in the newspaper that they're going to stop the count early. We need to have, again, I'm going to go down to the grassroots. The people at the grassroots level the people from the common walk of life, the people who don't have degrees like Dr. Wen and I, to understand how important it is for them to cast their vote. Far too many people are starting to think that their vote doesn't matter. It matters now more than ever. Fill out the census. It matters now more than ever. And so I think that together we'll get through this, but we have to get down to that grassroots level where people are getting mixed and misinformation. And Senator, you need to know that some of that misinformation is orchestrated by very powerful organizations, and in some cases, state actors, taking advantage of the tension in our society to foment confusion. And we cannot let that happen. So I totally agree with you and Dr. Wen around how to ensure that we make voting easy and that we push back against efforts to disenfranchise individuals because it matters now more than ever.
Dr. Thomas, I really appreciate you mentioning census. I know Dr. Wen is sensitive to the fact that every person that we do not count in Baltimore City in the census costs us money, and money that is used for public health, for hospitals, for healthcare. And the people who suffer the most are the underserved communities where we have the health disparities. So the census count is critically important for us to get right. And it's tough under normal circumstances to get everyone counted. And we have census workers who go around into communities in order to get a full count. Well, guess what? With COVID-19, who's answering their doors these days? I mean, we don't have that. So we have to figure out other ways to get it done. It's one of the issues that's being debated among our leaders as we speak to include additional time and resources in this next COVID package so that we get the census right. And the clock is really running on the November 3rd elections. And we really need to make sure that we protect the right to vote. In Baltimore, in Maryland, we've been told by our election people that it's going to cost millions of dollars more to do what Governor Hogan has ordered. That is a two-step process, requesting an absentee ballot, sending that in, then getting your actual ballot, mailing that back in, and then keeping every voting place open, the number of workers, the type of facilities we now have to use. It's going to be very expensive, so we have to make sure the resources are there. And then lastly, I can tell you that there's active information about foreign actors trying to interfere with our free elections. So we have a full plate to protect our democracy. And the local election boards are going to need help in this COVID-related package. Last point I want to mention, and I thank you for mentioning John Lewis. I was elected to the Congress in 1987 with John Lewis. We were classmates. And it was one of the thrills of my life to serve with him. He will be known as one of the great Americans and one of the great people in the history of our nation. And when you serve with someone of greatness, you don't always appreciate every minute who you're walking with. But to have shared time with him on this earth and to have been inspired by him was truly one of the great blessings I had in serving in the Congress of the United States. So I appreciate you bringing up John Lewis. And you're right, there's been justly said, he gave his life basically to civil rights. It's now our responsibility to carry that torch and to make sure that everyone participates in the November 3rd elections. Let me thank both of our guests, Dr. Wen, the former Baltimore City Health Commissioner, and we miss you, although you're still a city resident, as you said. I miss seeing you at restaurants. I saw you once before, but neither one of us are going to restaurants these days. Thank you for and to Dr. Thomas from the University of Maryland. Thank you also for joining us today. And I want to thank everybody for joining us on Facebook Live and YouTube. And we'll find other ways to try to keep you informed. Everybody stay well. And again, thank you all very much.